Hello everyone, welcome to PsychoPsych, a platform where we explore the fascinating world of mental health and well-being. In today's episode, we are going to look at what we call Alzheimer's disease. What is Alzheimer's disease? Alzheimer's disease is a progressive brain condition that slowly destroys memory, thinking ability, and eventually the ability to carry out simple daily tasks. It's the most common cause of dementia. Then, what happens in the brain that causes this Alzheimer's disease? One, clumps between brain cells and also twisted fibers inside brain cells. These changes damage and kill brain cells, causing the brain to shrink over time. Then, what are the common symptoms that when we see those symptoms, we know that it's Alzheimer's disease? At the early stage, one of the symptoms you see is forgetting recent conversations or events, misplacing things, or trouble finding words. An individual that sees these signs, it shows that it is the onset of Alzheimer's disease. One needs to rush to the closest physician in order to start to check and know the next plan of action. Then, as it progresses at what we call middle stage, the person will experience increased confusion, difficulty recognizing people, and problem with language and reasoning. Then, at this second stage, individual find this difficult and encounters this problem at the middle stage. Remember, I say increased confusion, difficulty recognizing people, problems with language and reasoning. So as it progresses, individual that has this disease experiences these symptoms. Then at the late stage or the last stage, the individual will begin to experience loss of ability to communicate. There will be need for the individual to be taken care of or need for full-time care. Then there will be changes in behavior and personality of the individual. Then what are the risk factors? One of the risk factors includes age, which is one of the biggest risk factors. Age. Then family history or genetics. Then lifestyle. Lifestyle also causes this Alzheimer's disease. Then one needs to do what? One needs to take care of diet he or she eats, exercise, and also conditions like diabetes have been found and high blood pressure to be one of the contributing factors of this Alzheimer's disease. Then do ask yourself, when one sees these things, does he have a cure? Alzheimer's disease for now does not have cure, but when it's detected early, it can be managed. Then what are the ways one can manage this Alzheimer's disease? One of the ways include one, medication. By the use of medications, it will help to improve the memory and the thinking. Then lifestyles. You have to change your lifestyle by eating healthy diets, engaging yourself in mental activities, exercise. It will go a long way to help it to do was to manage this Alzheimer's disease. Then why is it important for one to dictate this on time and go for management? It is very important because Alzheimer's disease doesn't just affect memory. It gradually impacts independence, relationships, and in all or overall quality of life. So it is very important for us to take into cognition all this and look out if there are people around us, our family members, our relations, our community members. Look out for our loved ones in order to manage this disease and take care of it early. And once we do that, it will help to bring a very good neighborhood environment, and it will improve our society. We are going to draw the curtain for today in today's episode. Till I come your way next time, I still remain your therapist, Dr. Kiro. Thank you. See you next time. Bye.